mirror, would you say you were completely happy and at peace with the way you look? What about your friends or your sister? Among all the wonderful women and men in your life, can you think of one who guiltlessly enjoys chocolate and cheesecake, revels in her or his wrinkles, and is blissfully relaxed in swimsuit? It seems that almost all of us are affected. Almost all of us are compelled by the idea of looking good or looking better, as if attaining physically or physical beauty, culturally defined, will somehow make us feel better about ourselves. For you, it may be the low-carb diet. For me, it may be an obsessive with the gym regime. For another lady, it may be distress at the rapidly increasing line in her face. But at the heart is the common concern about our appearance and desire to be physically attractive and even beautiful. That is why body image or perception of how we look often control our life, both directly and indirectly. Good evening. Tonight, it's my pleasure to welcome one of the most famous plastic surgeons in Northwest Ohio and Southeast Michigan, Dr. Frank Barone, it's going to be my pleasure to discuss with him something lighter subject comparing to what we had before. Today we are going to talk about personal image, about our look, about how can we improve our self-confidence on the long run, at our job, in our lifestyle, in our social event. And the bottom line, probably the expert will be able to shed the light to us about what is the best thing and what's the most commonly done these days to improve that image about ourselves. Frank, thank you for being here.
Pleasure to be here, Ameer. Thank you
for
having me.
Plastic surgery. I mean, it's probably the most progressed field at this point in the nation. But there is a reason for that. Do you mind to tell me why the people are interested in changing their image or their look?
Well, as you know, plastic surgery involves two areas: reconstructive surgery, the repair of defects, which is where the specialty actually began after World War I, and the aesthetic or cosmetic area, which can involve surgery and often non-surgical procedures. And I think the interest goes back many, many years, because the human drive to be more attractive, for a younger look to be more attractive, is really an evolutionary determined force. This is a force that evolved over many hundreds of thousands of years, because when you're more attractive, you survive and you propagate the genes, the species. So the desire to be more youthful, to be more attractive, has many emotional as well as physical consequences, and it's driven by this inherent human urge to survive.
And do you see that the population in general increasing their interest in that kind of stuff lately, comparing to what it used to be 10 years? There's a reason for that? Is it because it's getting simpler?
Yes, I think there's always been an interest, but now with safer procedures, many more options in the non-surgical realm as well as in the surgical realm, I think the results are much more improved and with greater safety than ever before. When a procedure or whatever an aesthetic procedure is done well, and when I say done well, there's a natural result, a subtle result, the patient looks and feels more attractive. And that feeling of being more attractive results in changes in the brain and neurotransmitters in the brain, dopamine, serotonin, et cetera. So now there's an increase in their mood, improvement in their mood. There's improved self-esteem and more self-confidence, which changes the way people react to them. So this is actually a measurable scientific result, and is really quite fascinating. Much more to do with trying just to be, more beautiful, so to speak. But now, as you were saying, there are new things such as Botox, which everybody I'm sure has heard of, and there's other substitutes or other Botox-like medications. And the goal really isn't to erase the wrinkles on the face. The goal isn't to paralyze the muscles of the face. The goal is to balance the face. So when one area is unbalanced or hyperactive, it can make someone look unhappy or threatening or sad when they're really not feeling that way at all.
When you're talking about the balance in the structure and the look, definitely require experience. And the people sometimes they have the fear, I don't want anyone to touch my face, I don't want anyone to change my look, because we see some programs in some cases which is really done to the extreme point, which is showing a negative impression instead of the positive good looking. So what's your advice to those people? How can we take out that fear, that concern from the mind of most of the people who wants to improve their image, who wants to improve their confidence by changing their look a little bit? But at the same time, they are afraid. They are concerned about the procedures and the risk of the procedures.
Well, first of all, you have to be very careful about who's doing the procedure.
Absolutely.
Because of the huge interest, and that is increasing dramatically in these new procedures, in looking younger, in aesthetic medicine, you have many individuals advertising these services. And they're really not very much regulated. In their own office and clinic, they can do just about anything legally, which is surprising to most patients. Some may say they're board certified, but are they board certified in the specialty that they're actually doing the procedure? And often that's not the case. Or people look for prices, you know, and so there is a lot of danger out there, because if done improperly, these procedures can injure someone, and we see lots of problems when it's done incorrectly, and they can be expensive and difficult to correct. So I think the first thing is you have to be sure that the person doing the procedure has been trained in that area, not in some other area and took a course, that they have experience, and that you check out their credentials. Because some of the results are not reversible if they're done improperly. On the other hand, when they're done by a trained individual who knows how to do that procedure, the results are quite exciting, because they give a result you can't get any other way.
How can the patient identify the places which he should go to? I mean, if there's any a reference they can go to, like, for example, websites, your association, I mean, the Plastic Surgeon Association site to talk about the people who are board certified, who are expertise. How can they know that, okay, I would love to go to this center because it's a good center based on the credentialing?
Well, I'm sorry to say that is extremely difficult, because some of this marketing is so effective that you wouldn't even know that the person doing it wasn't really trained in that area. So I think the first thing is you might want to check with the American Society of Plastic Surgery, because they have a lot of information for patients. But there's certain warning signs. Usually if there's a lot of gimmickry or advertising, that's often a sign that it's not a credentialed process. Some other areas do it just by pricing alone. If the price is way out of line with what it should be, that's another warning sign. I think the key thing is, so who's doing the procedure, and then you have to do your homework. Were they trained? Do they have a board certification in that area? So they might have had boards, especially in some other medical area, yet they're doing procedures that have nothing to do with where they were trained, because any doctor that takes a course can do a procedure in his office. There's no real regulation of that. In hospitals, it's a different story. They will check your credentials, but in your office, in these clinics, they can pretty much do any procedure whether they were trained in it or not. And many people are very surprised to hear about that.
I mean, the sad part also, I hear about non-physician doing some of the procedure which should not be done except in the expertise hand. And this is really more scary to me, I mean, than just having it, for example, board certification or not. Having non-physician doing some of the procedure, isn't it supposed to be regulated or limited somehow? I mean, why we are not getting to that point?
Well, there's a lot of politics involved, like with everything. And I think just because it's a physician doing a procedure doesn't guarantee you a good result.
Sure.
There are many nurses that do Botox injections and other injectables that are very good if they're trained appropriately. And states have different laws. Ohio has a certain laws about what nurses can and cannot do with lasers, for example. Sure. Where in Michigan, it can be different. So the states do have some bearing on that effect. But I think it boils down to if you ask the right questions on where they train, do they have board certification in that specialty, what their experience is, and if getting some kind of references, and they can always check with the American Society of Plastic Surgery,
so the
which has a website.
patient should not shy away from asking the question, what's your credentialing, to the individual who is going to do that procedure? I
don't think anyone wants to risk their well-being, their face, and possibly permanent scarring on that type of thing. So absolutely, get your questions answered.
Is your heart clock ticking? It's time to change your future with Toledo Cardiology Consultants.
A lot of people choose salad for a low-calorie, low-fat meal. This salad is 450 calories, and the dressing can add up to 100 calories. A grilled 7-ounce chicken sandwich has 350 calories. You could add a kid-sized fry and still have less calories and fat than that salad. Choose wisely, because I don't want you to end up here. Remember, time waits for no one. Frank, we are getting older, so I assume
Yes,
age...
we are. Unfortunately, that's very true.
I assume age has a significant role in the process of what should be done. From the plastic surgery and cosmetic environment, did you notice that the procedure which you do for the younger age, the middle age, the later age is different? I mean, the most commonly used?
Yes, and first of all, I'll get the bad news out. There's no such thing as anti-aging. You hear the term anti-aging all the time, a pill to stop aging, a procedure to stop aging, some other supplement that slows down aging. Aging is biologically determined and it's inevitable.
Sure.
But the effects of aging, the results of aging are controllable, such as 90% of the aging in your face is a result of sun exposure and smoking. And with new modern concepts in medical skincare, you can basically control 90% of aging in the face. It's called extrinsic aging. So there are a lot of things that can be done to change the effects, but aging itself is biologically determined. So what we're trying to do isn't to stop aging, but maybe to modify some of the effects of aging. The goal is really to be healthy. Whether it's the skin, we strive for achieving healthy skin, because healthy skin looks younger. Healthy skin is balanced. Healthy skin doesn't get as many acne breakouts. It doesn't have as many wrinkles. It doesn't thin as much. And with new technology in sunscreens, antioxidants, and other topicals, it's quite exciting. And then you can use lasers and other things to improve the surface qualities of the skin. All aging really has three components in the face. One is positional, meaning that the tissues can drop. Two is the surface, which is damaged either from acne scars or sun or thinning. And the third is volume. We actually lose volume in our face, and with aging we often gain volume where we don't want it. So restoring balance in the face by putting volume, if you look at a baby's face, there's no shortage of fat in the face, it's very full. So the new understanding of the naturalness of youth is what drives what we do in aesthetic medicine now. And you're right, for every age group it changes quite a bit. But we like a long-term plan. It always starts with healthy skin, and there might be some minor procedures for younger patients.
When we're talking about aging, one of the most common complaints the people have that I'm getting older, I can't lose any more weight, and we have that small belly, and and that brings us really to the to the liposuction, for example, which is commonly done. Can you tell us how safe, how good, who should have it? Because we are after the new year. There's too many people who has resolution, and how can we help them to make them understand how simple and how easy those procedures, if it's done in the expertise hand?
Well, liposuction is another area where there's many misconceptions. Many people think it's for losing weight. It's not for losing weight. It's for shaping the body. We advise patients, or try to get patients in a healthy lifestyle mode, to lose weight and then have liposuction, because even when you lose weight, you don't control where you lose it. And consequently, getting the body balanced and in proportion is what liposuction can do, because some areas don't seem to go away when weight goes down. So the first goal is healthy lifestyle. Healthy lifestyle, losing weight, exercising, and nutrition. We don't believe in dieting, by the way, but proper nutrition. And then liposuction can be used to shape and contour the body. And the exciting things in liposuction are removing fat less traumatically. We have a device called a Vaser, which uses a sound wave specifically that breaks up the fat cell wall but doesn't affect the nerves and blood vessels. So you can take the fat out without bleeding. There's really no blood loss anymore with this type of liposuction, that used to be a problem. And less traumatically, which means back to work more quickly. So liposuction plays a role, and there's new evidence where if you remove larger amounts of fat, it actually can lower patients' triglycerides, which I know that you might be interested in. I wouldn't say that's the goal of it, of course, but there's things released by stored fat, as we all know, that are damaging, related to increased cancer rates and other cardiovascular issues. I know 10 times more women die of cardiovascular disease than die of breast cancer. So we try to get our breast cancer patients thinking about their weight and their health, even though they're having breast reconstruction. Getting back to that holistic, comprehensive program of lifestyle modification and then proceeding from there. So
which is really bringing us that when we are talking about the body image and the self-confidence, and it fit together. I mean, that healthy lifestyle which you are talking about, it's not only to lose weight as much as to be ready for whatever procedure they want, but also that will bring their triglyceride, that will make them easier to exercise, lose weight, be healthy from the heart standpoint, from everything, from the lung standpoint. That's why lifestyle is so important.
Yes, and the powerful thing here is motivation. Most people fail in their dieting to lose weight or in their exercise, they lose motivation. And we've seen where a procedure is done properly and getting that subtle, natural-looking result, where patient's self-esteem goes up because they like their appearance, they feel more attractive. And guess what? When their self-esteem goes up and their confidence goes up, they're more motivated. So people who failed at nutrition and exercise before, after a well-done procedure where they feel more attractive, are much more successful at losing weight, at exercising and getting their triglycerides down. So many good things can happen when it's done properly. So that's the most exciting parts of this whole process.
When we are talking about building up that relationship between the physician, plastic surgeon, and the patient, which is a long-term relationship.
Hopefully so, yes.
Most of the people, they will start questioning about the cost. And I mean, now to my understanding, all of these are becoming much or less expensive than it used to be in the past, especially when you are talking about the non-surgical stuff. What do you think, I mean, about that? I mean, because the people sometimes even they don't bother to go and ask for an opinion because they are so concerned about the cost.
Well, costs are certainly a concern because anything in the medical area is quite expensive, particularly when you do it well and with great safety.
Sure.
And three things tend to drive a patient's decision. One, of course, is the recovery time. Secondly is the cost. The cost will drive a decision. And the third and the most important thing is really the result. Because if the result is tremendous, then people will accept a bit more cost if it's a long-lasting and safe result. At the same time, all three of those components are important. But to your point, with the advent of new non-surgical techniques, improved science, improved safety, the costs have come down because people want a less downtime procedure, and they want to be back to work with lower cost. And that's what the whole area of aesthetic medicine, non-surgical or less invasive procedures have provided. So that's been a very exciting area as well because cost is certainly an important component. We've seen many people, though, who tried to get something that was much less and didn't do their homework and had a complication because they went to someone who was not trained to do it, and they spend much more money trying to fix that complication than they would have if they had done it well in the first place. So there's great value in doing the procedure right the first time by someone who's properly trained to do it. So you have to put it in the perspective of that value.
So the patient really should do his homework or her homework and investigate really the physician who is going to do the procedure or whoever is going to do the procedure to be sure 100% that this is the right place, the right technique, the right procedure for them. Otherwise, the consequences is unbelievable. Now I'm going to talk, if you don't mind, about specific procedure. I mean, just to shed the light on it. First of all, in the younger age, the most commonly thing we talk about is in nose work. And is it still very commonly seen between that age, 12 to 18? I mean, they want to have their nose because of the structural changes?
Well, the teenagers, as we parents know, is a very tough time. A lot of emotion, a lot of drama, a lot of things happening. And we certainly, as Jimmy Buffett says, we don't want to make permanent decisions about temporary feelings.
Sure.
So consequently, with any teenage patient, we always involve the parents, a lot of counseling ahead of time, because there are select areas that can very much benefit those patients, but we have to make sure the decision is proper, that it's not just an impulsive thing. So with the younger group, we're very careful about that type of thing and hopefully have parental support. But I've seen patients where it transformed their lives, patients who had maybe a very unsightly nose in a young female, for example, and when the nose was shaped to fit the naturally evolved concepts of beauty for the face, it had a dramatic change in their life.
Wow.
I've seen patients where they had many acne pimples and they didn't want to go out and socially were unaccepted, where if we got their skin cleared through either lasers or through medical skincare with some of the ZO programs that we have, ZO skincare, big transformation. Their confidence has gone up, their self-esteem has gone up. So I wouldn't rule out teenagers at all, because we just have to be very careful on the selective process, and we obviously try to, less is more, try to do the minimal thing to do. But getting their skin healthy has a dramatic effect on them.
How popular it's still at this point for those ladies who had 2 or 3 kids and now they decide to have the tummy tuck?
Well, it's very popular because when they've had several children and they have excess loose skin on their tummy, the muscles can rebound a great deal after pregnancy or several pregnancies, but the muscles that are paired in the middle of the abdomen, the abdominal muscles, they can't go back together again once they're separated, so they're always apart. So they will never, no matter how much they work out, they can't get that dynamic support on their abdomen. And that can be repaired in a surgical procedure with the so-called tummy tuck, although I hate that phrase. That's really not what it is. It's not a little tuck.
That's why I remember it.
It's a reconstruction of the abdominal wall, removing the extra skin and fat, and often doing liposuction on the sides. But they can work out a lot, and they can be at their proper weight, and they still will have that extra skin. So this isn't something to substitute dieting and weight loss and exercise. It's to complement it. So for the right patient, it can have a very powerful impact, because they can't really get that any other way. So it is quite popular. And then for massive weight loss patients, we see a lot of people after bariatric surgery who've lost 100 or 150 pounds, and they can work out and get their muscles back in shape, but they can't lose all that extra skin that's hanging down. So we do what are called body lift surgery. We actually go all the way around the body and release everything and lift it up over the legs and the groin and the buttocks, and remove all that excess in patients who have lost a lot of weight. And again, that cannot be achieved any other way. So we like to fit it into that healthy lifestyle program again, where they've already lost the weight and they're exercising.
And that brings us also to the older generation, and when they get older, I mean, they start thinking about the facelifting and how popular and how easy to do something like that.
Well, I can show you some of our patients in their 80s who had facelifts. You'd be surprised. Our goal is when they're done that no one can really notice.
Exactly
they just
right.
happen to look better. And they can't really tell why. That's the goal.
Absolutely.
But now with improvement in anesthesia and with less invasive techniques, with tremendous changes in reducing blood loss with procedures, the recovery time and the impact is a lot less than before. So, you know, people are living much longer. We've almost doubled our lifespan in the last 100 years. They're out in the workforce longer. They still want to feel attractive. It doesn't go away just because you're older. Everybody wants to feel attractive. And it's not about just beauty. It's really, attractiveness is more than just physical beauty. There's an emotional quality, that self-esteem. I've seen people in their 80s are very attractive because they have high self-esteem.
What is the best advice from plastic surgeon to the people about plastic surgery, procedures, invasive, minimally invasive? I mean, what is the thing which you want them to remember out of this show?
Well, it gets to what we've been talking about, in that I think ultimately all of us want to look more attractive, and no one needs to apologize for that. And it's not an issue of vanity. It's not an issue of self-indulgence. Yes, there are some people that do that, granted, but for the majority of people, they just want to look more attractive and improve the quality of their life. So what we want to do as physicians is improve someone's self-esteem in addition to the physical improvements that we strive to obtain. So in a more holistic sense, we try to balance the emotional and the physical together. So I think it's not about procedures, it's not about having an operation, it's not about filling wrinkles or getting rid of wrinkles. It's really about balance and harmony and trying to improve overall health, which is related to our self-esteem. And the ultimate goal is improving quality of life, because it's not just how long we live, it's also how well we live. Absolutely. And there's no reason why we can't have both.
And I think probably the final message which I will give, that there's nothing wrong by going to expert plastic surgeon to ask the question and talk about what you want and how you want to look. I mean, there's nothing wrong. I always tell the people, it doesn't mean if you go to a psychiatric that you are crazy. Again, going to a plastic surgeon, something probably could make you very confident and give you the feeling that I want to change something in me, improve something in me, lifestyle changes, build up a relationship with someone who can monitor your aging process over the time.
As many people come in and they apologize, they say, I feel so vain for wanting to do this.
Yeah.
I don't want to look 20.
Yeah.
Well, actually, they actually do if they
do.
could, but they apologize for their own humanness. The humanness is that human drive to want to look more attractive, because it's hardwired in our brains. When we're more attractive, we preserve our genes. And that's the number one motivating force in all of humanity. So that's why you see so much going on with everyone trying to get it. It's unfortunate it doesn't get done well a lot of the times, but this is a human force. This is not some superfluous little emotion.
And I'm not going to be shy. I want to look 20. Can you make me look and feel 20?
We got a 20-year-old hairline already. Come by sometime, we'll talk.
Thank you so much. I really
Wrinkles wait
appreciate
for
it.
no one.
That's a good one. I think that's how we are going to end our show. Wrinkles wait for no one. We live in a competitive society where looking our best has a direct effect on our personal and business relationships. Just as we head to the gym and plan our diet to feel good, more and more of us are considering cosmetic surgery to improve our look as well as our self-esteem. Plastic surgery can help us with this image struggle, which often monopolize our perception of the world around us. In fact, a recent survey conducted by the American Academy of Facial Plastic and Reconstructive Surgery found that 85% of adult Americans would undergo a plastic surgery procedure if given the chance. Our perception of ourselves is reflected in our personality and treatment of those they come in contact with us. If we are not happy with the way we look, we often project it through negative body language or some other forms of communication. If you're considering to change your body image, start with changing lifestyle, then talk to the expert about the best way to help you achieve that goal. Because remember, time waits for no one.